Hi, good afternoon. Today, I think you've already seen in the description that we're going to discuss about the writing module. So, before you all must be aware that we are having like four different modules, correct? At least, do you have any idea about what this OET exam is all about? Anyone knows what is this OET exam all about?
Yeah, it's all about writing, speaking, listening, and
Okay.
reading.
Perfect. So it is an English assessment, like as Rachel said, yes, we have like reading, listening, writing, and speaking, all four. So what a language would require? These are the four modules. All right. So I'm not going to do all the modules. Okay, I'm just going to do writing today. So do you all know what exactly writing would be? Any curiosity? Do you have an idea what exactly can be writing?
Referral letter.
A letter. Let's keep it that way. Okay. Maybe, yes, as you say, it can be a reference letter, but it's a letter. Okay. So, how many of you all have idea about writing a letter? Maybe just let's keep it general letter, not about any case study, not about any patient. Generally, have you all learned letter writing in your school days?
Yes, ma'am.
Yes, ma'am.
Yes, we all have learned letter writing, correct. So, using the little bit of concepts of what we learned in our school days, we're going to blend in, and but we're going to write about the patient here, of course. Okay. So let me just quickly like share my screen. I'm going to tell you what exactly the writing. But here, this session is not going to be what I'm going to tell you. Okay. This session is something about what we're going to learn together. That means I want you also to come up and ask your doubts. Of course, it's a half an hour session, but then we can understand how to pick up, like information. Like mainly when I say picking up information is like, how do I know what is important in this letter? All right. So I'm going to showcase two different letters, but I'm going to talk about one letter. Just to understand, I'm going to showcase two different letters. Okay, so I'm sharing my screen. Okay, so now if you look at this, this is how a case notes will look like. Okay, this is how a case notes means your writing task will look like. Okay, so you have 5 minutes to read, you have 40 minutes to write. So you all must be aware about the patient information. For example, if you're working in your hospital, who actually gives a discharge letter? Do you write discharge information of the patient anywhere? When you are writing the discharge information about the patient, right? Do you all write discharge information of the patient?
Yes, ma'am. We are
Yes.
writing.
So where do you write the letter or you write just the discharge information in one particular, book or something that you make notes of? Where do you write?
Ma'am, one book, we having one notebook like there only we have note that this
Okay.
patient is.
So you have a book actually, so you're making a note of the information. Am I right? So Rachel, or anyone else here, can you let me know what kind of information do you make notes of?
Patient name, hospital number,
Mm-hmm.
diagnosis,
Mm-hmm.
and surgery is not required.
Okay.
And at what time patient left the ward,
Okay.
and signature of the patient or the relative.
Okay. But so this is the information. Do you write what are the symptoms?
Usually, we won't write in that note, ma'am.
You won't write in that note. Okay. Follow up information. Do you write like maybe follow up in a week or follow up in 2 weeks? Do you write those information also, Rachel?
No, 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 ma'am.
No. Okay. So that means we have an idea like what we are going to make a note of it, right? So if you look at the screen here, you have the information about the patient's name, the age of the patient, when was the patient admitted, when was the patient discharged, what is the diagnosis, okay, the background information of the patient, which including the relative part and all those things, the nursing notes of the patient, okay, with different dates, and the discharge plan, and this is what is called as writing task. But let's not go before there. Now, when you look at these information, do you think that this relates to your work where you write the information? Do you all agree with it?
Yes, ma'am.
Do you all relate with it? So yes, so do you all, can anyone can say no, I don't know this information, or is everyone able to relate to it? I'm sure somewhere you can relate to it, right? Where you're writing it down. So that's what it is. So you know we are actually doing the tasks related to what is your work environment looks like. You must be, some people have so much of confusion before even, preparing for OET. Or is it like possible for me to clear OET? I've heard people writing a couple of times. Okay. Some people feel, oh, yeah, oh my God, I think this module was quite difficult for me. I think this particular task in writing is difficult for me. I don't understand the case notes, especially. I think a lot of people have their own challenges. Am I right?
Yes,
Am I
ma'am.
right? Yes.
Yeah, ma'am.
So now to avoid those challenges, what is that you have to do? What is that you feel something can be done? Okay, here is what you have to do. You should understand here how to write. So most important is like when you look at the writing task itself, gives you the clear information about the patient part here. So this is the information that is being given is actually say that write a letter of referral to gives you the care clinic information. Okay, and it gives you the address also. Am I right? Is everyone able to read
Yes,
the screen?
yes, 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 ma'am.
Just giving you the name, the person, and the address whom you're talking, writing the letter to. And it's also giving you information here saying that you are writing, she says, community nurse to make sure Mrs. Brampton continues her cessation of smoking. So that means you're writing this letter mainly to advise the patient to cessation on smoking, correct? And it says that with the help of a nicotine patches and Zybin, so Zybin tablets to cease or soon a side effect occurs if any. All this information is given, but not every case notes will have this information. Not every writing task will have this information. You should understand that some information will be given like just write what is on it, what is being required, and the medical history or past medical history, something like that. Okay, it will vary. I will just simultaneously show you another letter with the writing task alone. It says here, using the information in the case notes, write a referral letter. And it's talking about substance abuse. You're talking to a substance abuse center where you're talking about regarding alcohol issues.
Yes,
Am I
ma'am.
right? Yeah. So one is talking about smoking cessation, one is talking about alcohol
Alcohol.
substance abuse. So I've just picked up these two case notes actually somewhere to relate to looking at what exactly we are seeing. So you look at the information, the case notes in the writing task is varying from one letter to another letter. So it's always very important to read the writing task. I'm not going to dwell in of writing the letter. All right. I'm just making you to understand here. Okay. So it's not important for us to, like, what do you say? Like, not that greatly important for us to feel that fearful of the, like tasks. Okay, as we say, oh my God, this particular task is complicated. So let's break it down to understand how to pick up. Most of the people say relevant and irrelevant information. What information has to be written in the letter? So we're just going to understand that point here only. So I would want you to unmute, answer the questions, or you can ask me questions. So that let's make it more interesting here. Okay, because I can understand only Rachel is actually answering compared to the others. But what I really want anyone just unmute and ask me questions or where we can discuss. So this becomes useful for you. Okay. And when you look at the writing task here, okay, we know for sure, there's a lot of information given here. This is talking about the alcohol substance abuse. So we know name is given, date of birth is given, age, family address, everything is given. So we have a family background, social background, medical history of the patient, okay, family history, diet, current medications, everything. Lot of information is given, and the medical treatment record for one particular 30th one, 2 2 4 2. Different dates are also given. Okay, so now can you tell me, as whatever information is given here, should I write everything or there is something that I can ignore or leave it away? How will I understand? How will I understand that all information are important or no?
We can skip date of birth.
You can skip date of birth because age is given. Okay.
Yes.
Here, let's run by this. Okay. It says family background is given three daughters, all under 10 years old. How wife is, I mean, you have a, I mean, wife is a housewife, lives in the ground floor flat. I think you're talking about Mrs. Sorry, the patient is a housewife. Okay, so she lives in the ground floor flat. She's been a keen jogger, heavy drinker, non-smoker. Now, in this social background, I mean itself, can you tell me what you think you can ignore?
Social background.
Heavy drinker
Okay, heavy drinker,
or keen jogger.
keen jogger. Now you're talking about the alcohol substance abuse. So
Yeah,
heavy
okay.
drinker becomes relevant
Yeah, yeah.
information,
Yeah,
correct?
yeah. Yes, 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 ma'am.
Yes. Maybe keen jogger,
Keen
as you guys
jogger.
said. Yes, I don't think so. That should be a great information to be writing. Yes, of course, you can skip it. But what about lives in a ground floor flat?
That is also not required, ma'am.
That is not required. Great. Yeah. And what about, like non-smoker and retired factory worker? Which is important here.
A retired factory worker is important comparing to non-smoker, because we are writing about, because its title itself mentioned social background. So non-smoker is not that much.
Very good. Non-smoker, you don't have to write because you're going to talk about if he's smoking, you're going to mention it there. Since he's a non-smoker, I don't have to mention it, of course. Okay. Now, since you're talking about this alcohol substance abuse, I'm sure retired factory worker will help them to understand what is his background. Am I right?
Yeah.
So, analyzing with who the reader is important. Analyzing about what is the patient condition is important here. Once you know that, yes, where the relevant and irrelevant information becomes easier. Let's go to the medical history. Visual blurry, retinal damage, type 2 diabetes since 2000, carpal tunnel in right hand. Now, these three things, which is important, or all the three is important?
Type 2 diabetes and vision blurry retinal damage is important comparing to carpal tunnel in right hand.
Okay. And why do you think that's most important here? Yes, we can talk about vision because he's actually, we don't know what is the level of his alcohol consumption, even though they've given here. Another history part. It's good to mention. Diabetes is yes, 100% we have to mention. Am I right, Rachel?
Yes, ma'am.
That's right. Okay. So now what about his family history and diet? Family history is unknown. I don't have to mention it. Am I right?
Yes, yes, ma'am.
Diet being vegetarian, maybe I can mention or not mention. It's not mandatory here. Okay. What about his current medications? We're already mentioning his retired factory worker, so we don't have to write about it again. What about these two? Paracetamol and other things.
Diabetes is very important
Okay.
because he's a type 2 diabetes patient. So
Okay.
you have to write what are all the medicines he's on.
Perfect. Yes.
And
He's a type 2 medic. He consumes, what do you say, like he's actually consuming, takes diabetes medication that he self medicates about it. Okay.
mm,
Paracetamol when required. I think it's good to write.
yes,
Correct? Yeah.
yes,
Yeah. The most important part here is like, I should also the medicines here. And in the admission diagnosis, okay?
Alcohol abuse is will be the primary diagnosis for this patient.
Perfect. Alcohol abuse is important. Vomiting continuously, yes, you can write. He shakes also is important. Am I right? So during hospitalization, he's presented with all these things. Am I right?
Yes.
Okay. So we can inform that, at the time of hospitalization, so she was presented with alcohol abuse, continuously vomiting, and also shakes. So they have not written as hang, shake, or shake. It's written just shakes. Okay. So yeah. Now, in this medical treatment record, take a minute and let me know whether it's important for me to write everything or can I miss anything. Is there anything that I can miss or everything is important?
I'm 31, 2018, tube inserted into the mouth and windpipe is not required.
Okay.
Um,
Why do you think that's not required? It's part of the
because
treatment plan, right?
um,
And moreover, you're writing this letter to the Dr. Michael Smith. He's a healthcare professional. All right. So that's the most important thing. Everything that comes under whatever happened in the hospital, we will have to mention it. Okay. So it's like you can mention it, but in a concise way. A tube was inserted into mouth and windpipe, and as he was as she was dehydrated, a saline IV drip was also initiated. Okay, and on second, she was awake but weary. Feeding was normal. Okay, and unable to recall what happened last week. Okay, so everything should be concise way. Then you can say after 2 days, she was feeling better, and she was requesting for the immediate discharge, and she was discharged. And then you can talk about the nursing management. All these are important. You can't miss out anything. In the same paragraph, you can write her observe. Her what is her blood pressure and temperature were, or you can say vitals were in normal in range. Okay, that's all. And then the discharge plan. In the discharge plan, you think everything is important, what we have to we are referring to the patient abuse center. Okay. Request treatment, request patient education. Now, what we will write here? It's an abuse center. So, what do you think we can write? What point is important here to write? Or should we write everything?
substance abuse center.
You're writing it a substance abuse center. So, you're referring. I don't have to write that he's being referred. So, I can remove this point. What about requesting treatment and patient education? Request treatment and
But,
request patient education.
because it's important because it's a referral letter. So we need to
Yes, so you
mention that.
can definitely write, okay, in the view of the above, it would be greatly appreciated if you could, educate Mrs. Thompson and, educate, yeah, what's her name? Yeah, educate Mrs. Robertson and initiate the required treatment. Correct?
Yes, ma'am.
Yeah. Now, we all would have done these letters in our childhood days. We'd write yours sincerely and yours faithfully. But when do we use yours faithfully? When do we don't use yours sincere? When do you write yours sincerely? Any idea? When do we use yours faithfully and when do we use yours sincerely?
Yours sincerely we use if you are writing to our higher officials.
Okay. Let me rephrase it, okay? Yours sincerely is used when the name of the reader is given in the writing task. So here, the name of the reader is given to be Dr. Michael Smith. So it becomes yours sincerely. But instead of writing the name of the Dr. Smith, it just says doctor. That means it'll be yours faithfully. Correct?
Okay. Yeah, okay, ma'am.
Understood? Is it clear? Yeah.
If
So
doctor, if names comes means we have to write sincerely.
you're
Is no,
right.
ma'am? Yeah.
Yes. If the name is given, the name will write yours sincerely. If the name is not given, it is yours faithfully.
Yes, ma'am.
All right. Yeah. So the main thing is like, of course, the flow of the letter is different. We have not discussed that because the main agenda to do this particular, writing discussion was like to understand how the writing task is looked at. Because I know that before even you guys can practice OET, you all have a feeling that, oh my God, it's going to be really tough. Am I doing it properly, or is it going to be complicated? I know there are a lot of things that runs behind your mind. I just wanted to ensure that, you can relax and do it, because some people, yes, would have tried IELTS, and, find who's finding OET to be complicated because, they feel that IELTS and OET is something general. Okay, but I just wanted to understand this is more related to your work profession. Okay, maybe the vocabulary is help giving, assistance to you during our classes, so you know how to structure it, the flow of the letter you can structure it, and of course you'll be doing so much of writing tasks again and again, so it's quite useful for you. Okay, I just wanted to make you feel understand that it's not that complicated like as what you people think from the out. So if you can start doing things, it becomes easier. And you all must be knowing OET is the first step for you to go abroad. Okay, so that's most important. Okay, maybe sharing this would help you to understand that writing task isn't that complicated if you know to, maybe if you know to understand the main agenda of writing, or how to, pick up that proper relevant and irrelevant information. I hope the session was useful for you all.
Yes, ma'am.
Okay. Okay, guys. So all the very best. And if you want any additional information, maybe if you want to get to know about classes, you can always connect. Like to our institute, you can always get to know about it. Okay, and we'll see in the upcoming sessions as well, because you'll be having few more sessions, maybe in the upcoming days. So see you there. Okay, all the very best. And, I wish you all a great success in life. So if you want to really gear up by doing OET, please ensure that you connect with us and you get more information so that you can actually get your dream done. All right.
Yeah,
Achieve
sure.
your dream. That's most important. And I think because nowadays, getting stuck is something which maybe people don't like it. Okay, so all the very best. Yes, see you all in maybe in the upcoming days. Have a great future and have a great evening. Bye bye.